Hi, welcome to the APA Virtual Conference of 2020. I'm really excited that you have taken time out of your day to attend my presentation, focusing on what is considered a controversial topic for some evaluators that are out there. I think with these unprecedented times of COVID-19 and the implications that it's had on our school districts and continue to have on our school districts, I think it's important that we at least address the possibility of evaluators engaging in remote testing in the near future. And it's very important for those individuals who decide to move forward with remote testing to start planning now, get your practice in, and follow some of the considerations and the tips that are going to be provided within this presentation. So I just wanted to take a moment to introduce. My name is Tammy Stevens, and full disclosure, I am a clinical assessment consultant for Riverside Insights. So as many of you know, we do publish and sell the WJ products. I'm also an educational diagnostician, a former special education teacher. I've got over 20 years in the field of special education. I've worked as a university professor and was in charge of the educational diagnostician program at Texas Women's University. I'm one of the authors of the CSEP model, the Core Selective Evaluation Process, and I'm the founder of Beyond the Score webinar series that I just launched this summer. So I'm excited to be here today. I'm excited to provide you with some guidance and some considerations around the use of remote testing. So assessment practices during COVID-19, this is the conundrum that we are all faced. As I see it, there's two testing options, actually three if you consider just no testing at all. But the two testing options for those who decide to engage in evaluations during this time is either the face-to-face or the remote testing. So with the face-to-face, and I know there are some individuals that are currently engaged in face-to-face evaluations, we got to keep in mind the safety of the evaluator as well as the examinee. So with face-to-face, it basically entails conducting testing in person through the use of personal protective equipment, so PPE, while you're engaged in social distancing measures. So what I've seen a lot of evaluators do is use plexiglass barriers between you and the examinee, as well as masks and face shields. And there's the attempt to keep that 6 feet distance. The other option is remote testing. And with remote testing, you're going to be conducting testing remotely using a teleconferencing platform and a digital stimuli. This can be done in many different situations. The home-to-home, where the evaluator is in their home or office, and then the student or the examinee is in their home using the computer, the teleconferencing platform. There are some that are looking at conducting remote testing in the same building but different rooms. So it allows for that distance to be there for safety issues. And then there's some that have talked about actually setting up the remote testing in the same room but spread out on opposite sides of the room. So there's a lot of different options out there and different ways in which testing is occurring. So Riverside Insights, we do have some COVID-19 resources on our website page. So I do recommend that you visit the website, look at some of those resources that are available. And I'm going to highlight a few today during the presentation. One of the resources, regardless of whether you decide to test face-to-face or remotely, that I think is very important is the consideration of what the impact has been on the student with regards to COVID. So I developed a COVID-19 impact profile checklist. My colleague and I, Sarah Holman, decided that we were going to create a document that would allow evaluators to really examine and document possible implications of COVID on the examinee, on the student, and for evaluators to really take into consideration these impacts when making a decision around whether or not to test, as well as using the information as part of the interpretation of the assessment results. So I'm going to give you my contact information at the end of this presentation. If you want a copy of this, you can reach out to me and I'll be happy to send you a copy. But really, we're looking at what the direct impact of COVID has been on the student. Did the student have a parent or close family member or friend that was diagnosed with COVID? Or was the student diagnosed with COVID? And if so, what were the details and treatment around recovery? Was there a death of a close family member or friend due to COVID? If so, who was that? We need to keep all these things in consideration when we are making decisions about our students. I also give some guidance around psychosocial considerations as well as socioeconomic considerations, because again, we know that these things can impact our students in a negative manner. And these things need to be addressed as part of the assessment process. So understanding whether, when we're looking at the socioeconomic considerations, you know, was the student receiving free and reduced lunch prior to COVID? And if so, has the student been able to continue to receive those lunches? I know here in Houston, a lot of our districts set up for parents to come pick up lunches. So it's, you know, important to know this. Also, did the student's parents or guardian lose a job during COVID? We know that the stressors around parent losing a job, that lack of income, can have a very detrimental effect on the student as well. We've also seen lines of individuals waiting for food bank assistance. You know, what did that look like for the student? Even things around healthcare. Again, all important information that we need to take in consideration. The other part is looking at the educational and academic considerations. So understanding what the child's strengths and weaknesses were before COVID and then during COVID, what their grades were before and during. We know that a lot of districts have indicated that the grading during that last semester during virtual instruction was a little more lenient than the grading prior to that. So really kind of weighing that out and taking that in consideration. And then looking at the virtual academic instruction, what was the quality of instruction, and also what was the student's engagement in that instruction. And these are things that you would need to reach out to the parent about, to the former teacher, as well as the student themselves. So again, important information to consider when you're deciding to move forward with evaluations. Riverside has also provided some guidance on the COVID website on interpreting norms during a significant disruption in education. So I really highly advise you to take a look at that as well, look at what the guidance states. Really what we're suggesting is that you use both grade-based and age-based norms and really look at the student's performance through both of those lenses. The other thing that I really like to point out is for you to remember that a test score is only one piece of the puzzle. So as you are moving forward with the use of PPE, if you're doing the face-to-face administration of the tests or the remote administration, always document and consider all deviations from standardized procedures. Consider the results through multiple lenses and in relation to other sources of data. So again, we're not going to overemphasize these test scores. These test scores are going to be interpreted alongside the other sources of data that was collected on the student. Also, as I just mentioned, consider those results from COVID-19 impact checklist when interpreting the data, and then consider possible implications of the quality of the virtual instruction, the levels of support that the student had during virtual instruction, and then what the learning structure during school closure looked like. All important information. So that brings me to the remote testing, which is the purpose of our presentation today. And I'm going to say that this is going to be a general overview. I only have 30 minutes to talk about this, but I do have a more in-depth webinar that's complimentary, and I will provide the information at the end of this slide deck. So understanding what remote assessment is. So for many of you, remote assessment is probably not a new thing. When I talk to school-based evaluators, it's very new to them, but I know a lot of private practitioners are already engaged in some sort of teleassessment practice. So what I'm going to do is talk about the COVID-19 pandemic and the impact it's had on assessments, provide a brief definition of remote assessment, talk a little bit about the platform technology and environment that's required, and then talk about becoming an effective remote examiner. And then I'm going to show you the WJ resources and platform. So with the COVID-19 pandemic, school closure and social distancing, I had a lot of evaluators reach out to me during that period of time, wondering what they could do to move forward with assessing students who were already in the referral pipeline. So these were individuals who were already referred prior to the school closure. Others I've heard have been referred since the process since the schools have been closed. And so these evaluators were reaching out wanting test publisher guidance on what could be done during these unprecedented times. And as I mentioned, I recognize that this topic is controversial for some, but the other piece is to understand that during these unprecedented times, we do want to continue to serve our students and provide the services they need to be successful. So due to these unprecedented times, we've decided to grant temporary permission for test batteries to be used in a remote assessment process with caution. And we emphasize with caution due to the fact that these tests were not standardized in a remote assessment way. Now, I think it's also important to point out that these tests were also not standardized with the use of PPE. So anytime PPE is used or remote assessments used, as I mentioned, any deviations from standardized procedures needs to be documented, and it needs to be considered as part of the analysis of the data. We also have had professional organizations like APA that have weighed in on remote assessment and provided some really good guidance to evaluators. But ultimately, the decision to engage in a remote assessment is really the responsibility of the examiner, and based on if you're in a school district guidance, or your licensing board. So again, you as the examiner have to take responsibility when determining whether or not to engage in remote assessment. Also, clinical judgment should always be utilized. So just like with the other publishers, Riverside Insights has a response letter to the COVID-19, and you can access this online at our riversideinsights.com or on the wjscore.com platform. And it's basically giving you permission to utilize our tests in a remote testing way with caution. We also wanted to point out the privacy policy, and our platforms are secure. However, as you're choosing the teleassessment platform, you need to be aware of the risks they have and what their privacy is or what their security levels are. Again, we're not advocating any one platform. That, again, we're leaving up to the practitioner to make that decision. But we just suggest that regardless of the platform that you choose, that you do your research to make sure that you are in compliance with HIPAA and FERPA. So examiner considerations. These are some considerations that were put out by NASP back in 2017. And as I mentioned, I know many private practitioners have been engaged in teleassessment practices for quite some time, as you can see the 2017 date. But really what they're stating here is that if you decide to engage in teleassessment or remote testing, that you carefully prepare yourself to deliver remote evaluations. And one of the things that I've learned through this process, and I started practicing back in March when all this started, is that it does take some time to get comfortable with delivering these tests remotely. I've used the WJ for many, many years. Feel very confident in a one-on-one setting, person to person. But when you lay over that additional layer of technology, it does become a little more cumbersome. So you really need to prepare yourself. And that's part of the reason we're doing this, we're offering this presentation, is because of not knowing how long COVID's going to be around, and as schools are coming back for fall, you really need to take the time now to prepare yourself if you're considering remote testing. You also need to consider the examinee's capabilities and needs. We are in no way stating that remote testing is appropriate for all students. You as the practitioner need to examine their capabilities and their needs and determine individually which students would be good candidates and which wouldn't. And I've got some guidance that I'll highlight for you that's in the guidance document that I put together that might help you a little bit with this. Also looking at the appropriateness of the testing environment. Does the student have an environment that is distraction-free? Does the student have the space to do it in their home? The capabilities of any facilitator. I'm going to talk a little more about facilitators in a second, but this is an area of great controversy because the way things are set up now, the home-to-home testing, your facilitator is typically going to be a parent. And we know that due to test security, and we want to make sure that parents aren't helping the students, we want the facilitators to have the minimum amount of interaction as possible. And I'll talk a little bit about that here in a minute. Access to particular technologies. Again, we have to make sure that the student has adequate technologies, a computer, the audio, the video capabilities, and also internet access. And then, of course, adhere to applicable local, state, and federal guidelines. So as I mentioned, I have conducted extensive research. I did a review of the literature and consolidated the information into a guidance document. And that guidance document is the tips for remote assessment using Riverside Insights clinical products. And this can be downloaded if you're a WJ user. You can download it from the WJ online scoring platform, and it's under the resources tab. I believe it's the first link right at the top of the tab. So when we look at remote assessment versus face-to-face, I just wanted to point out the research is in its infancy. There's not a lot of research out there. I often state that if anyone on the call is working on their dissertation, this would be a great dissertation topic. There's some equivalency studies out there. One in particular, it was done by Jordan Wright, and he looked at the WJ4 remote administration versus the face-to-face, and he found that there was no significant differences in scoring on all indexes of the WJ4. Again, you have to keep in mind this is one research study, and that they actually used this the Presence Learning platform, and the facilitators were well trained in assisting with the assessment. So just something for you to keep in mind. I know there's a new study that just came out, I believe, with regards to the WISC, and I think they found similar results. So here's the equivalency study. If you Google online, you can download it as a PDF for viewing. So when you're looking at remote assessment, legal and ethical implications, really throughout the remote assessment process, you must maintain professional and ethical standards applicable to face-to-face. Also follow those state and federal laws, as well as any guidelines issued by a school district or employer. And then really do your research state licensing requirements for remote assessment, because they do vary from state to state. So that guidance document that I showed you, it gives you a step-by-step guide for conducting a remote assessment, from selecting the candidate to obtaining consent for the testing. I really advocate that you hold a remote assessment screener session before the actual formal assessment takes place. Conduct the formal remote assessment, and then there's some post-assessment requirements. So I do outline this. I have some checklists for you to follow as well as you go through the process. So again, when you're considering a remote assessment, not every student is a good candidate. So we need to keep in mind that remote assessment must be deemed effective, safe, and appropriate for the examinee. We also need to use our professional judgment, our knowledge of the examinee, cultural competence, and cultural sensitivity. Be mindful of the developmental challenges. So be mindful if the examinee has issues with vision, hearing, fine motor. Fine motor is really important, because some of those tests that require pointing, the student's going to be using the mouse or the touchpad to actually point using their cursor. And then also be mindful of functioning levels of the student. And then some examinees may have limited access to computers or the internet. So again, keep that in mind. And then also we need to really keep in mind the examinee's exposure, experience, and comfort levels of technology itself. So within my guide, and this is on page 15, I do have a remote assessment decision tree. Takes you through each of the steps. And after each step, I have a decision point to indicate whether or not you should move forward to the next step. But this is the snapshot of that first step, in that you're going to determine whether the student is a good candidate for remote assessment, even before you move any further into the process. Also highly recommend that you obtain informed consent for a remote assessment. Once you've identified a potential candidate, you need to contact the parent or the guardian to determine if they're willing to allow you to conduct a remote evaluation. And with that, you need to explain to them what is a remote assessment, what are the pros and cons. You have to get consent to having the child assessed, make sure that they have all the necessary technology, that they have a location that's suitable for testing, and if they're willing to or have someone in the house that's willing to serve as a facilitator. And then be sure, again, to explain that the evaluation might be discontinued if the child appears to struggle. Because we do want to try to get the best results as possible. And then again, if it's agreed upon, consent can be taken and preparations for remote assessment screener are made. And I would properly document that contact was made, and if circumstances are inappropriate, if they don't have the technology, list why you've decided not to move forward with the process. So here's a snapshot of the checklist that's in the tips guide. Again, this is for the informed consent. As I mentioned, I really highly believe that a screener should be conducted prior to the formal assessment. So once you've talked to the parent on the phone and decided to move forward with remote testing, you should schedule a screener with the parent and the student using the same teleassessment platform or teleconferencing platform that you plan to use during the testing. So this allows you to meet the student, build rapport with both the parent and the student, ensure that the technology is working, that they have adequate technology, ensure that the student knows how to use a mouse or mouse pad, and then depending on age, ensure that the student knows words like first, second, third, or first, next, last, and then conduct that COVID-19 student interview if appropriate or if it hasn't been done already. So again, your remote assessment screener should last for approximately 15 to 20 minutes, and it does allow you to really screen out and make sure that student and the technology is adequate, as well as the location space in the house is adequate for a remote assessment. So I've created this sample screener that I like to use, and it's not a standardized screener. It's just something that I put together to really test out the audio. So I have the student repeat sentences after me. I also, it allows me to determine whether they can hear me and I can hear them. I also like to test out the mouse manipulation. So I have this stimuli that I project on the screen. I give dual control of the mouse, and I have them click on each of the items listed. And then I like to test out whether they know the concepts of first, second, and third. So I'll go through this prior to the formal evaluation. So the facilitator needs and roles, again, ideally we want minimum facilitation. And so what we really try to do is only have the parent or whoever decides to serve as a facilitator, only have them participate in the preliminary readiness stages. So having them there when you go through the remote assessment screener and setting up the testing environment. Now, if you're using moderate facilitation, this is where the facilitator plays a larger role in the process. It's important that you provide them with some training and some specific guidelines around what is allowable and what's not. We want to make sure that they are not in any way helping the student with the assessment. So they might do things like assisting the examinee with finding the correct page or starting point in the response booklet. They might provide feedback to the examiner when issues arise around the audio-visual equipment, or they might assist with keeping the examinee on task during the testing situation. So again, we really strive for minimum facilitation, but there may be situations where moderate facilitation is required, and if that's the case, you need to be very specific with the facilitator as to what they are allowed and are not allowed to do. When you're looking at the platform and testing environment, we need to make sure that the examiner has the remote testing platform, whether it's Zoom, whether it's GoToMeeting. There's different platforms out there, so you as the examiner would need to choose that platform, the proper technology available, proper testing environment, and then proper training and practice. The remote assessment platform, examiner and examinee side, it really needs to be secure, and it must comply with all applicable local, state, federal, and organizational rules, regs, and laws, and that's according to APA and NASP. Both parties must have a secure login. Data and files transferred must be encrypted, and then also ensure computers being used are updated and secure. Keep all examinee identity confidential and secure, and then maintain thorough documentation, including all records pertaining to an evaluation. Here's the technology requirement checklist. Again, making sure that each of these items are available if needed. The peripheral camera is something that is suggested but not necessary. There are ways of dealing with looking at the document camera. I've seen individuals using laptops pull down the screen so that you could see the student record form. I've also seen YouTube videos where the parent has converted their iPhone into the camera, and they log into the platform as well, and the examiner can see what the student is writing. So it basically is used as a document camera. Testing environment, of course, we need a distraction-free area. We need workspace, a table, a desk, where the examinee can work. The lighting has to be adequate. They have to have access to a reliable high-speed internet, the mouse, audio, video. With the audio, it's recommended that the student wear headphones. That way, if there are other distractions in the house, it'll kind of muffle those, but it is not necessary. It's not required. So again, practice is very important. If you are thinking of engaging in remote testing, I really suggest that you get together with a colleague or an associate and start practicing the administration, using the platform, displaying the digital stimuli to the examinee. You want to follow the administration procedures as closely as a face-to-face administration as possible. Also practice preparing the facilitator for their role. Again, really try to strive for minimal participation from a facilitator. And as you learn from training and experience, identify which criteria would include and exclude an examinee from remote examinations. So there's a lot to consider. So Riverside Insights, for those of you who own a WJ products, we have made the test easels that require digital stimuli to be shown to the examinee. We have made those available on the online scoring platform, and we are not charging any additional fees for you to access those if you already own a WJ kit. So the resources in the platform, so if you have the WJ, the WMLS, the ECAD, the Batteria, you should have copies of their tests during the evaluation. You are going to need the test easels for the directions because those are not included in the digital stimuli that's on the website. You're going to need to use those to provide all your verbal administration and the tests that require the oral examinee responses. So again, only those tests requiring visual stimuli can be found on the digital format under the resources tab. Copies of test manuals have also been uploaded to the resources tab. And then you've been granted access, if you own any of these test kits, you've been granted access to the digital stimulus books and easels at no additional cost. So when you log in and you click on the resources tab, this is what you'll see. The tests that you do own will be been uploaded along with the manuals. And then here's the tips guide that I put together as well. So you can download that as a PDF. So for those tests that require the examinee to use a response booklet, what we really suggest is that you put the student response booklet in an envelope and secure it along with another envelope and seal it, sign your name across it, the seal with the Sharpie, and then get it to the parent, and then it should be opened. They should know that they can only open it during the testing situation. So when it's time to use the response booklet, you can inform them to hold it up, show you that the seal hasn't been broken, have them open it, utilize it for the test, and then have them put it back in the other envelope that was included inside with the response booklet, and have them seal it and sign across it and show you that they did that. That way we know that they didn't go in and change anything. So how do we handle the administration of tests requiring the examinee respond to testing stimuli? And as I mentioned, you have access to the digital testing materials through the online scoring platform. It also has the audio recordings that are needed. But if you need to deviate from using the audio recordings, you can administer those items orally. Again, make sure that you document that in your report. In the back of the tips guide, we have put together a checklist of each of the tests, the COG, the achievement, and the oral language, with all the tests that are included in each of the batteries, and then whether they require stimuli, a student response booklet, if it's verbal only, or requires audio. A good thing about this is that as you're planning your assessment and you're wanting to limit the amount of interaction that the facilitator has, you want to get them out of the room, then you can look and plan out those tests that you're going to need the student response booklet and do all those tests at the same time, then move on to either your stimuli tests or your verbal only tests, so that you're not jumping back and forth during the assessment process. So there's a checklist for all of the tests that are included on the platform. So in summary, just remember that the test score is only one piece of the data and should be used with multiple sources of data. Again, we are living in unprecedented times. and we want to ensure that our students continue to receive the services that they need to be successful. So we have provided flexibility permissions for using tests remotely. Remember, remote testing is not appropriate for all candidates, that you as the examiner need to investigate and determine who would be an appropriate candidate and who wouldn't. Remote testing may require slight deviation from standardized procedures. And if that happens, it's vital that these deviations be documented and considered as part of the interpretation. You should not take remote testing lightly. Prior to engaging in remote testing, consider all the pros and cons. Adhere to your state, federal, and district level guidance regarding remote testing, and then practice, practice, practice. I can't say that enough. So I mentioned at the very beginning, I am the creator of Beyond the Score. It's a webinar series that I've been offering since COVID started, trying to offer professional development to evaluators. I do have a more in-depth webinar that's free. You can see the dates here, and I also have some demo videos of actual testing within the presentation. So if you're interested in attending one of these, please email me. I'd be happy to send you the link so you can register. I also have a Beyond the Score Facebook page if you're interested in joining. We upload resources there as well. And then this is my contact information. If you have any questions, feel free to reach out to me. I'd be happy to help. And with that, that's pretty much what I have. I really appreciate your time today. I hope that you are staying safe, and I hope that you're able to find a way to maneuver through these unprecedented times. And I really hope that we get a vaccine and are able to move away from the COVID virus. So again, I appreciate your time, and I hope to hear from you in the near future. Thank you.